Welcome back to the Own Your Becoming podcast. Today we're talking about perimenopause through the lens of traditional Chinese medicine, or TCM. If you're curious about perimenopause beyond hormones and HRT and want to understand how a system-based medical framework explains this phase as a whole body shift, not just a hormonal one, this conversation will be useful. Traditional Chinese medicine looks at the body as an integrated system. Organ networks, blood and fluids, energy circulation, and nervous system load all interacting together. From this view, midlife change follows patterns that can be worked with strategically. In TCM, this phase is often referred to as the second spring, a reorganization of how the body allocates resources as reproductive demands recede. To explore this perspective, I'm joined today by Dr. Tara Foster, a licensed acupuncturist, doctor of Chinese medicine, and Western clinical herbalist with over 15 years of clinical experience. Dr. Tara, thank you so much for being here.
Thank you for having me. I'm so excited to talk about this today.
For listeners who are new to this, can you give a brief overview of what traditional Chinese medicine is and how it approaches health differently from a Western medicine approach?
Yeah, so in traditional Chinese medicine, we go over what we call the 10,000 questions. And when we diagnose somebody for what's going on, we usually have a diagnosis that's called a pattern. And we look at their constitution, what's going on, and there's basically a 5-element system that helps you decide what somebody's constitution is. There's a 12 meridian system that is used for diagnosis and for treatment. For example, you might get diagnosed with a liver imbalance, but that's actually not your actual organ of the liver. It's the entire liver channel. Liver channel starts at the toe and goes all the way up to the chest, and it wraps around the genitals. So it's often correlated to a lot of different reproductive health issues in both men and women. A lot of times people get that confused, like something really common that kind of helps separate the view of Western medicine versus traditional Chinese medicine is like, I'll tell somebody that they have a liver deficiency and they're like, oh, I don't even drink alcohol. Because in Western medicine, often liver imbalances are correlated to alcohol abuse, like liver cirrhosis or something. One example of a difference that I think most people can understand, but it's never ending.
How can the lens of traditional Chinese medicine help women understand the season of perimenopause?
So in traditional Chinese medicine, we look at perimenopause as the second spring. In Chinese theory, there is this thing called the cycle of 7 and 8. And for women, they go through these cycles of 7, and for men, it's 8. And so we're just going to focus on women here. When you hit perimenopause, you're at the 7th cycle of 7, and that's when your yin starts to decline. And it's also considered a second spring because it's a new beginning, a step into wisdom in life, a celebration of freedom. There's 3 times in life where we say that there's a chance for people to overcome chronic illnesses, and that's in menarche, which is when you first start your period. There's a lot of endocrine changes that happen then. During pregnancy and birth, because there's a lot of hormone changes happening there and dynamics with qi and blood, which allows you to recover from lifelong illness. And then again in perimenopause and in menopause. So when you choose at these times to really nourish your body and take care of yourself, you can honestly overcome lifelong illnesses or lifelong ailments or chronic issues that you've been dealing with for a very long time. And so that's one of the reasons that it's called the second spring.
Years ago, I had these recurring rashes on my arms and chest. And in the medical system, I was referred to a dermatologist and I was diagnosed with chronic urticaria. And the solution was this long-term medication. I later saw a TCM practitioner and everything came back to what he called liver energy. I'm not very familiar with all of these systems, but I just know it's a recurring something to do with my liver energy. What I noticed was a pattern. The rashes would show up every year between January and May. And then during those 3 years, I would receive acupuncture. And after about 3 years, the rashes just stopped coming back. Now, I don't know if it was the acupuncture or something else, but the pattern resolved. Can you help us just translate this language a bit more? Like, what do these systems really mean in traditional Chinese medicine?
Well, yeah. So correlating to this rash and it coming back in the spring times, February right now, and we just went through the holiday of Li Chun, which is the beginning of spring. And so in the Chinese calendar, we actually just started springtime right now. The energy of springtime is the liver, and it's when the yang is coming back from the utmost yin. Winter is the utmost yin time of year, and then the yang is starting to rise. And so when you have liver yin deficiencies, the yang rises because the yin can't contain it, and it can express itself in a rash. A rash also can be heat in the blood level of the body, which often rashes are really related to heat in the blood level of the body, but it can express itself as a rash. This is all related to the liver system. The liver holds the blood, and when there's heat in it, it's just the body expressing the heat. It's another way of releasing waste products, basically. Rashes also always correlate to the lung channel and the large intestine, which is the metal aspect of the body, because we say the lung manifests in the skin. So usually if you have any type of skin problem, it's correlated to the lung and the liver. And that's what we're going to use to treat your body. The lung is a yin yang pair organ with the large intestine, and the large intestine removes waste from your body. So maybe that can allow you to kind of see how it correlates. Like if you're not properly releasing this waste, it's going to come up on the skin.
You mentioned a lot of yin and yang, and just so we understand a little bit more, in perimenopause, that's a season where yin starts declining. Is that correct?
Yes. So perimenopause marks the decline of yin in the body. There's this, so the kidney yin is declining, and the kidney is the root source or our pre-heaven chi or our Jing chi. The Jing chi is what you look at for most reproductive stuff, for bone growth, for mental development, for all of those things. That is all led by the kidney. We say the kidney is the root of Jing chi. And so it controls the bones and the marrow, and it controls your willpower. It's the foundation of all yin and yang energies in the body. And so when you start to look at perimenopause symptoms, you can kind of correlate most of them with the decline of yin in the body. There's also other organs involved, like the uterus is called the bao mai. And during your reproductive years, the bao mai connects the heart to your uterus. And when you go through perimenopause, the bao mai just moves all of your qi and blood to your heart. And so the heart is the shen of the body, which is like your emotions, your vibrancy, and your spirit. That's something that happens with perimenopause and menopause and postmenopause, is that all of that energy that your kidneys were using to help you to reproduce humans is now just going to your heart to express your spirit and your emotion. So you have this decline happening, but it's like your natural way of preserving longevity. In traditional Chinese medicine, the life expectancy is 120, and we're going through menopause at 52 to 55 years old. So in reality, you're like not even halfway done living your life. So the kidneys, to preserve themselves, are moving their energy up to the heart and the heart blood. And so a lot of the symptoms in perimenopause, like anxiety and insomnia, and when people become like a little bit more sensitive to different things, that's all related to the heart blood and the heart chi.
So that sounds like it's a natural shift happening, that we're becoming more sensitive. Is that why we tend to be more emotional during this period, or that's something different?
Well, I feel like we're more less filtered on expressing our emotions, more so. Like I can relate it to the liver and the heart are more the organs that would be involved with these emotional aspects. We say the liver holds the 7 emotions. So that's basically dealing with all of your emotional well-being. And so a very common thing that happens for women in this patriarchal, suppressed society that we live in has to deal with suppressing our emotions and not really saying what we want to say. And so this can show up in PMS and premenstrual syndrome. You're like doing just fine, holding it all together. And then all of a sudden, it's like 3 days before your period, you're having a complete meltdown. You want to leave your partner. You hate everybody. You just can't handle anything that's going on. And it's like this veil that we're going through where we're unable to hold the filter of our emotions together. And I think that I believe that perimenopause and menopause is basically this on steroids. You've been suppressing, I mean, it's not everybody, but a lot of people have been holding back and suppressing their true thoughts and opinions to not damage the male ego or whatever it is that they're doing. And it holding, like being polite, holding it together, keeping the community going. And you've been suppressing that for 40 years, basically, like 15 to 55. And you just can't hold back anymore. And so, and then I think with the energy, your chi and blood moving into your heart is your expression. Like the element of the heart is the fire element. So if you, like, for example, if you wanted to talk about a fire constitution, this is somebody who's like the lead singer of a band or somebody who dances for a living. Like they're just, that's very yang and it's very expressive. And so we have this energy shift that's moving into our heart. And so we're lacking the filter, and then we have this extra like chi and yang that moves to our heart that wants to speak and like express itself. The heart opens to the tongue. It's about speech. And I think that yes, we are, you may be perceived as being more emotional, but I actually think people are just not holding back anymore.
Yeah. Yeah. Just staying on the yin and yang topic,
Mhm.
I sometimes hear, sometimes the imbalance is a yin deficiency, and sometimes, so it's like the yin deficiency can't balance or contain the yang, and sometimes it's overly yang.
Yeah.
So, I guess in this season, how do you distinguish between, what's overly yang or a yin deficiency?
So your standard yin deficiency presentation is going to be, there's a lot of ways to describe this. So if I'm going to do this on pulse diagnosis, I'm going to take somebody's pulses and they're going to be really thin and they're going to be a little bit stringy. They're going to have um, no coat on their tongue. There will be poor memory, possible loss of hearing, night sweats, a lot of dryness, dry mouth and throat, vaginal dryness, low backache, constipation, dark urine, fatigue, and depression with a little bit of anxiety. Usually with kidney yin deficiency, anxiety isn't like really strong, it's just like faint. And then when you're dealing with a kidney yang deficiency, it presents a little differently. You have a lot of these similar things, but you might have diarrhea right in the morning. We call it cock's crow diarrhea. And this is like a kidney yang and spleen deficiency. And you might have more fatigue throughout the day, and you have low backache, you might have more bloating, all of these things. Your tongue is going to be fat and swollen and wet, and your pulses will be a little bit wider. And so these are like distinguishing factors between kidney yin and yang deficiency. But the bottom line is with perimenopause, we're normally treating both. There's two common pictures here. I mean, really thin women who are very dehydrated and dry and maybe have very gray hair and are tired and their bones are getting brittle. This is all like very standard kidney yin deficiency. That's going to be like making sure you're getting enough rest and hydration and taking herbal tonics. And with a kidney yang deficiency, this person in their past might have had it PCOS or something like that. Usually with kidney yang, you also have a spleen yang deficiency, and so your body isn't it's not warm enough, so it's not metabolizing your food and stuff, so you maybe are gaining extra weight and you're cold all the time and you feel really sluggish and slow and kind of heavy.
So when we approach perimenopause with TCM, is the idea to increase yin?
Sort of, yeah. You basically want to like nourish the yin of the body.
Nourish the yin. Okay.
Yeah, we say nourish or we say tonify. And so, like, if you were going to give a herbal prescription or a food prescription, you would give people things that tonify yin. And these are, yin is very like heavy and cloying and thick and cold. And so those are the types of things that you want to nourish with. So I'm always telling people like you need to be eating your yin foods. And this literally can translate into fats like um healthy fats in the body literally go to your bones and help you have stronger bone density. And that's just like a very good example of like yin. The kidney yin controls the bones and the marrow. And when you have kidney yin deficiency, you're getting thinner bones, your bones will break more easily. We say that the brain is the sea of marrow, which is also very much controlled by the kidney. So, a common complaint of perimenopausal women is brain fog. And this also can be related to kidney deficiency because the kidney isn't nourishing the marrow of the brain. We want to just nourish the kidney, and so this is rest and these fatty foods, no cold plunges. That's not the right answer. No, yeah.
Speaking of cold, in Chinese culture, we know to drink warm water. It's just always been in the culture.
Yeah.
In Western culture, it does not exist. So I always get a weird look when I'm asking for warm water.
Yeah.
Can you explain a little why is it so important for women to drink warm water and not ice cold water?
Well, we say the spleen loathes cold. In traditional Chinese medicine, the spleen is one of the most important organs. It transforms and transports all of your gu qi, which is the qi that you get from drinking water and eating food. That's why it's important to drink warm water because it goes into your body and your body can absorb it. When you put cold water in, you're basically having to use all this yang qi to warm it up. And then your yang gets exhausted. This creates all sorts of problems like bloating and gas. It also can cause constipation because your fluids start to dry up because you're using too much of them to try to warm your body. That's one of the secrets that they talk about in Chinese culture is everybody's drinking warm water and resolving 85% of their symptoms literally by drinking warm things.
How can we help the listeners identify, like you've been drinking too much cold water and that's the source of some of these symptoms? So you mentioned bloating, constipation. What else could be caused by drinking cold water?
Fatigue, brain fog, pain. Your pain can be more because things are cold causes things to constrict. Yeah. One of the big ones is bloating. I have many people who come in and I can clearly see that they have yang deficiency or spleen yang deficiency. And I'm like, how many cold beverages are you drinking? Because they're complaining about being bloated all the time. And they're drinking like iced coffees or iced beverages, or drinking smoothies every day, or having salad all the time. And I'm like, just please try to just eat warm things. And then, it resolves their symptom completely by just doing that one simple shift.
So for anyone listening, if you're experiencing bloating issues and drinking a lot of cold beverages, try warm and see how it changes things.
I honestly think that if you're having strong perimenopause or menopausal symptoms, trying to just incorporate warm liquids into your diet might help resolve a lot of your symptoms, sleep and everything too.
When a woman comes to see you during perimenopause, what does a typical assessment look like?
Well, we start with just their main complaints, and then I kind of go from there. One other thing that happens too when there's like deep heat in the body is women will start to experience acne, which is something that I see a lot. And that's an example of like heat in the blood. If you're having insomnia, is it hard to fall asleep, stay asleep? Are you waking up at 3 a.m.? Are you waking up at 5 a.m. and you can't fall asleep again? You're waking up fatigued. Like, I'm going to ask you all of these questions. I'm going to ask you about your bowel movements. Like maybe you're having a bowel movement every day, but it doesn't feel complete or it's scanty. I want to know about your history with pregnancies. Have you had abortions? Have you had children? Did you have vaginal births? Did you have C-sections? How close together were your pregnancies? Did you breastfeed the whole time? How long did you breastfeed your children? Um, it's just a very detailed question and answer that we go through. uh, but these things are all important. Are you having night sweats? Are you having hot flashes? What time of day are you having them at? Are they related to you getting upset about something? Or are they just happening out of the blue? Taking all these little pieces and putting them together. And then we'll look at your tongue. I'll take your pulses. The pulse taking system is very complex. And depending who you talk to, you could have an entire day's long class on it. But there's 6 positions. the right side of the body is the yang side of the body, and the left side of the body is the yin. So when we're checking your right side pulses, we're checking your chi pulses. We say the right side is more chi and the left side is more blood. And on the right side, we check your lung, your spleen, and your kidney yang pulse. And on the right side, the positions are the heart, the liver, and the kidney yin pulse. And it can go way deeper than that, but this also tells us a ton of stuff about what's going on.
So rather than going through symptoms one by one, can you talk about the patterns you commonly see during perimenopause?
Yes, I'll just list off some of the main diagnoses that we get so that you can see that how vast it is and how different it is for everybody, because that's something that I think is really important to think about. I feel like right now perimenopause and menopause is like hyped up in pop culture and people are talking about it, and I love that. And everyone it really feels like people want to put like a blanket statement on do this for your perimenopause and your menopausal symptoms, and it just is a little irritating because it's so different for everybody, and I think that's a really important thing to think about. So some of the patterns that we diagnose with are liver yin deficiency, heart heat, kidney yin deficiency, kidney and spleen yang deficiency, damp heat, qi stagnation, liver yang rising, blood stagnation, damp heat. So all of these things can manifest with different things. Most of them have all of your standard perimenopause and menopause symptoms, but it's the other details that kind of help put you into the category of one of these pattern recognition diagnoses. And that's where we'll go for point protocols and for herbal formulations.
What about acupuncture? Where does that fit into all of this?
Yeah. So, in general, acupuncture just reduces your cortisol levels in your body and promotes the movement of qi and blood, which brings in white blood cells and boosts your immune function. But with the 12 basic meridian systems, we have all of these point combinations. I mean, there's acupuncture points all over your entire body. I like to think about it with each of my patients as finding the perfect constellation that's going to help their ailments. And so after we do our intake and we have our diagnoses, we're basically putting together a point prescription for each perfect person specifically. Also, there are probably like 5 acupoints that you could give to every single person that is going to benefit their health. For example, we have this point right here. This is called large intestine 4. Often I needle it and everyone, like it hurts. They feel all the other points, that doesn't hurt, this one hurts. And everyone's like, what is that point for? And it's large intestine 4, which when you say it out loud, it may not sound like a very important point, but this point treats like so many things. It's the command point of the head. So it treats all sorts of things in the brain. It's also the yuan source point of the large intestine channel. So it's helping with elimination in your body, but it also is paired with liver 3 to move qi and blood in the body. And it's one of the most common point prescriptions that's used in acupuncture globally. They're really trying in biomedicine to show what acupuncture does on a cellular level. There's this study that came out a few years back where it shows like the movement of blood cells and like the inflammation that's occurring and like the color and the disorganization of this person before they got acupuncture. And then the point prescription they did on this person when they're studying their blood is they just did large intestine 4 and liver 3. And you can see like the blood starts moving in a uniform fashion, the inflammation goes away. And it's just because of these 2 points. We call it the 4 gates. And it's basically opening up the gates of the flow of qi and blood in your body. So if you think about that with the 300 plus acupuncture points that are just standard protocol across the body, there are a lot of different things that we can do with each point. For example, the urinary bladder channel is the first channel to form in the womb, and it starts right here at the inner canthus of your eye, and then it zigzags up and down your head and up and down your back, and it has all these really important shoot points that are like a direct diagnosis of the organ on the back. But then they also have this outer shoe point that directly relates to the spirit of each organ. So you can treat spirit imbalances as well on this channel. And then the point exits at your pinky toe. If you have a breached baby, something that you can do is you can use a moxibustion stick, which is a stick that's made out of mugwort and some other herbs. And you just moxa the pinky toe for like 10 days, and usually it can flip a breached baby, which I think is really interesting. So it's just very complex. There's so much
Yeah.
to each channel, and you can like talk forever about everything that's going on in there. Another acupoint that's really popular that you can do on yourself is stomach 36. It basically helps build qi and blood in the body. So in menopause and perimenopause, you're deficient in qi and blood and yin, and this point is just going to help build that. So it's going to energize you and reduce your symptoms.
So if we were to give people a little acupressure routine that could be very supportive in perimenopause, can you give us a few points that a woman can do maybe like every night to just help support her system?
Yeah, I definitely would start massaging right here. This point is called the yin tong, and this
Mm.
point helps to release heart heat. So in all of your qi moving up from the bao mai, from your uterus to your heart channel, it can create all this heat, especially if you have deficiency. And this is going to be showing up as like anxiety, insomnia, really vivid, crazy dream that you're waking up and you're like, what the heck just happened? So I would start here with yin tong. That point's really great, especially like I don't know if you can see in the video, but I'm pressing here and it's red. I have some heart
Yeah.
heat. I have a lot of dreams, and so it's already showing like I need to get that point acupunctured, because when it's red like that, we say there's aggressive energy trapped in there. So if you're like pressing any of these acupoints on your body and the color changes, usually you could use that point. I also think that pulling on your ears like this, doing a little squeeze on your ears, can be a really beneficial thing. We call the ear a homunculus. And in a community type setting, we do a lot of what we call auricular acupuncture, because the ear is basically representative of an upside down baby. And so squeezing the ears like this can really help just nourish all your entire body and kind of like release any tension that's in there. And so I would start there, kind of go down the body. There's this point here in the elbow crease. This point is large intestine 11, and we call that the fire engine of the body. It like releases heat. One of the diagnoses for like, really severe hot flashes, like you're having them all day long, your hands and your feet may be really hot. Sometimes there's women who they just want to be outside, or they want to be in a cooler because they're just hot all the time. We call this steam. It's an empty false heat, and we call it steaming bone disorder. It's basically extreme yin deficiency, but this happens often, I see, with perimenopause and menopause. And so this point, large intestine 11, is the fire engine of the body. So that's going to help reduce a lot of your heat symptoms. So there's a lot of sinew there. If you have like something like a gua sha tool that you could gua sha over it with or massage it with, that would be more helpful, which you can do that at home. And then the large intestine 4. So these are both on the large intestine channel, which is interesting. And then on the inside of your knee, right below it, there's a point called spleen 9. This point is called a Hussy point on an earth channel. And so it basically helps balance the water in your body, nourish the spleen. So one of the common symptoms of perimenopause and menopause is weight gain. You can directly relate that to spleen qi deficiency. So this point on the inside of your knee, spleen 9, can be very beneficial to help nourish your spleen and help have the water in your body kind of go where it's supposed to go. Stomach 36, you move from the inside of the knee to the outside of the knee, and it's about 3 inches below the lateral kneecap. That point is going to help with fatigue and build your qi and blood in the body.
When we do acupressure, how long should we do it for on every point?
Say like 1 to 5 minutes per point is usually good, depending on how long you have. If you are just not wanting to take that much time, or you don't have that much time for self-care, you can do like 10 to 30 seconds as well.
Is there a difference between like rubbing the point versus tapping it?
You could argue that you're still stimulating the point no matter what you're doing. So I think it's just like whatever feels good for you. Yeah, ideally, when you're doing acupressure, you want to have some type of tool, like a gua sha tool that has a tip on it, so that you can really like pinpoint. Even the heart-shaped ones that are very commonly used, you can just point the tip on the acupressure points.
Okay, so we mentioned stomach 36, the yin tong, pulling on the ear, the L11 on the outer elbow, L4 on the palm of the hand. Was there any other points you wanted to add to this?
Yeah, there's two more points I want to add. I want to add spleen 6, which is on the inside of the calf. If you go from the medial malleolus, which is like the bone on your ankle that sticks out, if you go up from that 3 inches right there, it's painful. It's called spleen 6, 3 yin crossing. So it's an acupoint where the spleen, liver, and kidney channel all cross. And if I had to say the most important organs involved in perimenopause and menopause, it's the spleen, liver, and kidney. So this point can be really beneficial for kind of evening you out and balancing yin and yang. And then the last point is on your foot. It's in the web of your foot between your big toe and your second toe. And if anybody's had acupuncture, they know this point because usually it hurts a lot. That's the point where people are like, "Oh, don't do my
Yeah.
feet." Because this point's painful. And if you press on it, it's usually pretty tender, but that's a really good one. This point moves liver qi stagnation. So this point's especially good for anybody who's dealing with rage. They just can't handle coming home and dealing with their kids or their partner. It's just too much. Like all these things, I would say this point. Also, the coolest thing about when you acupressure this point is you're usually pressing as well on the bottom of your foot, the ball of your foot, and that is kidney 1, which is where the kidney channel starts. And so nourishing that point as well is just going to help build your kidney in, and it has an effect on kidney Jing as well. So you can like kind of pinch your foot and you can get at both of those points. I also really like that combination for stopping a panic attack.
Okay.
Yeah.
So if you're in the middle of feeling rage or you just can't stand someone in your family, you can just reach for your feet and start acupressuring that point.
Yeah, totally. It also is going to distract you from whatever's bothering you. Help change your brain.
In TCM, do multiple symptoms often trace back to the same underlying system imbalance?
Yeah, so we can start with kidney deficiency. So if you have like lifelong things that are going to affect your kidney deficiency are like overwork, too much stress, too many babies close together, too much like trauma, fear, shock, dealing with a really high stress life or dealing with high stress situations, this is all going to tax the kidneys. And so you're going to have these people showing up with like kidney yin or yang deficiency. Often with, trauma or abuse survivors, we'll see a factor of kidney yang deficiency. Their kidney is depleted from trauma. And then with liver qi stagnation, this one's really common with a lot of the symptoms that you see. And this can be from emotional upset over a long period of time, environmental toxins, holding back true thoughts, being polite and kind or acting how women should act. All of those things stagnate the liver qi and can cause a lot of imbalances. I would say those are the two main things that I'm looking at when I'm dealing with perimenopause and menopausal symptoms. It's like, where's their liver qi, what's going on there, and what's going on with their kidneys.
So for most women today, almost everyone is overworked. And if you have a career and you have kids, often you're in a situation where you don't really have a choice. You can't just drop these things. So what can they do in their life to, I guess, nourish their kidney qi?
Well, I would say that something people should really look at is having one day off a week. Like, take it, do it. It sounds crazy to a lot of people, but it's so important and it can nourish your body so much. Like, just one day off a week. Maybe you're still driving your kids to sports practice or whatever, but your main focus is staying home with your socks on and your pajamas and being cozy or whatever is nourishing to you. If you can get away and you don't have children or whatever, do a spa day. Just anything that's like deeply nourishing to kind of help your body just have like a true day of rest. In our overworked world, I wish more people would just focus on one day off. Like, and on that day off, I don't mean go no partying, no socializing. Like, these are all yang activities that are going to keep using up your yang energy. You need to focus on like a yin activity. If you want to be around people because you're a social butterfly, go to a sound bath or a yin restorative yoga class. You could go to a spa and sit in the hot tub in the saunas. These are all yin activities. Also, if you can just soak your feet at the end of the day, some of the my mom friends who are very busy, I often hear like I get all my kids to bed and then I just have me time and I'm staying up too late. They want to do, whatever they want to do, but I can encourage you to maybe like have a foot soak. If you could just do your nightly foot soak, you can sit down, you can scroll on your phone, whatever junk brain things you want to do, read a romance novel. I don't care about that. Just you're sitting and like I guarantee you soak those feet and you're going to start naturally feeling sleepy because your body is like it's nourishing your kidney in and you're going to start to kind of come into your center and like want to go to sleep.
So daily night foot soak.
Yeah.
For someone who doesn't have a whole day to take off, at least this little routine can help.
Just a tiny little routine.
Can it just be just hot water or because I've heard about mugwort foot soak?
Yeah, mugwort is super popular because it builds qi in blood and it nourishes yin and yang. Mugwort is a super popular herb to use and it's very commonly used in Chinese and Asian cultures. So you can use mugwort. You can just do salt as well. Salt is something that nourishes the kidney. I mean, it coincides with the water element and helps break up stagnation. Also, it usually has magnesium in it, which can help calm the body and relax it.
So nourishing the kidney really means to do something that relaxes your nervous system.
Yeah.
Less stimulus, less input, less doing, really allowing yourself to rest and recover.
Mm-hmm.
Proper rest.
Yeah.
So it's not something we can just supplement away.
No, unfortunately, it's not. I mean, our culture wants to do that so badly. Yeah, like I said in the beginning, the kidney is the root of all yin and yang, and it's also the most yin organ of all the organs.
Yeah.
Season that's correlated with it is winter. And we all know winter is a time of restoring, looking inward, and deep nourishment and deep sleep. And I'm constantly telling people, I mean, we're just kind of starting to come out of winter right now, like with it being the beginning of spring. But the past couple of months, I've constantly been telling people, I'm like, if you want to sleep 12 hours, sleep 12 hours. This is the time of year. And this type of behavior going through life and the seasons of life is going to really deeply help restore you and promote longevity.
Yeah.
We're just so attached to that grind culture and people are like proud that they slept 4 hours and they're like still functioning. And I'm just like,
right.
I'll see you in 6 months to 3 years when you're completely burnt out and you're just like going through complete burnout and correlating to adrenal fatigue. That's like a kidney and kidney yang dynamic.
I want to talk about sex quickly. Too much sex also depletes the kidney. Is that right?
Yeah.
How much is too much?
Well, this is a big question here because in the textbooks, depending on your age, they're basically telling you to have sex like once a month or once a year. Very conservative. And I don't think that's the case. I would say if I was going to make a judgment call on like what I actually think depletes your kidney Jing, which is what happens with too much sex, is if you're ejaculating multiple times a day, that's way too much. Females can ejaculate as well. If you're having an orgasm like that, like 3 days a week, I say that's healthy. That's fine. I'm not going to worry about that. If you're experiencing a ton of kidney yin or kidney yang deficiency symptoms, I would say that is too much. That maybe you should cut it down to like having an orgasm or ejaculation like once a week, just because you're going to help to store your yin. Yeah.
So you mentioned this depletes kidney Jing. Can you just quickly explain what's the difference between kidney yin deficiency versus depleting kidney Jing?
Fair. Well, kidney Jing is technically what you were born with from your parents. And we correlate kidney Jing usually to sexual fluids. Like you can read these texts about how when the woman orgasms, it's pure Jing coming out of her and it's life force. And you can use that life force to enhance your life force, like as like a golden elixir. I mean, in some things. But that's fluids. You can also correlate Jing to fluids. So when you're dry and you don't have this like essence to you of fluid, that's also like a Jing deficiency thing. It's a little bit hard to like completely translate it into English. It's kind of like when people ask you what chi is. Um, but Jing deficiency is always linked to yin deficiency because yin is the fluid aspect of the body.
So, does that mean it's better for us to not ejaculate? Like for a woman who I imagine that's the squirting, right?
Yeah.
If a woman does squirt, is it then better to not squirt and keep that?
Well, I think that it can be a huge release. And I think that it's really healthy for you. I just think that maybe not squirting every week, like, or not every day, like a couple times a week. I think if you're just a normal, healthy person, I think is totally fine. And yes, I mean, there's all this tantric study about like storing an orgasm and storing that chi in your body. If you want to like correlate it to that to kind of understand it a little bit more, is you're like in like the kundalini energy, you're like storing that to enhance your output. So you're like storing yang and storing yin and storing jing by like getting to a point where maybe you are having an orgasm but you're not squirting. I think that that can be really helpful. It can be helpful for men and it can be helpful for women. Yeah. But I don't think that there's any need to like hold back from completely expressing your pleasure, because I honestly think we have more of a problem of people holding back. So I don't really want to encourage that too much. But if you are gifted with the ability to have free flowing squirting orgasms whenever you want, then yeah, maybe it would be a good practice to like do it every other day.
Good to know.
Mhm.
I would like to zoom in on sleep
Mm.
because it's one of the most common challenges that women experience in perimenopause. And when sleep is off, everything else is just harder. So you did mention there's different types of sleep issues, falling asleep, issues staying asleep, and this waking up. And I have experienced that. Like, I would wake up every day at 3 a.m. and sometimes it's every day at 4 a.m. And once I start waking up, it's like I will have a few consecutive days where it's every day around that same time. So can you tell us a bit more about how TCM understands sleep issues in perimenopause?
Yeah. So the main organs involved with sleep are the kidney, the heart, and the liver. And so you're going to want to just look at what's going on there. So if you're, tossing and turning all night long, you usually have liver or heart blood deficiency. And so basically, the blood isn't holding the yang energy. So the yang can be exuberant and you're just like tossing and turning, you're sleeping light, and your yang didn't go into its little home for the night for you to sleep in. If you're waking up at 3 a.m., that's usually a liver qi deficiency. I mean, a lot of times people who are waking up at that time, there's a pressing emotional issue that's bothering them, whether it's grief or anger or stress or whatever, worry, whatever you want to put on that. I honestly have not met somebody who wakes up at 3 a.m. That's not the reason why. And so that is correlated to your liver qi and the liver health or liver yin. If you're waking up super early in the morning, that is more of a kidney deficiency. And so that's when we're going to be like, okay, your kidney yin and yang dynamic is really the issue here that's affecting your sleep. Falling asleep is usually heart heat or some type of heart yin deficiency or kidney yin deficiency affecting the heart, causing heart heat. And so that's when you would want to work on clearing that heat that's in the heart. And like I said, this yin tong point, really great for that.
Mm.
Or nourishing it with da zhao or jujube date can be a great aid before bed to drink um, jujube date tea. Usually we don't drink jujube date on its own because it's pretty sweet, but like right now I've been mixing my jujube dates with lemon peel and damiana. It just helps with stress and kind of makes you feel a little bit euphoric, and then it can promote like really deep sleep because dazao builds blood, it clears heart heat, and it calms the spirit. And when you have heart heat,
Okay.
you usually have spirit disturbance. or we call it Shen disturbance.
Okay, so for someone who has issues falling asleep, they can do some acupressure on their yin tong before sleeping, since they can't sleep.
Yeah.
And a good tea that they can try is a mix of jujube date. That's like the Chinese date,
Yeah.
right?
Yeah. Jujube date is a Chinese date, da zhao, all the same thing.
So it's the Chinese date mixed with they can mix it with lemon peel.
Yeah. Lemon peel, you can mix it with ginger, you can mix it with licorice.
The main important thing is the jujube date.
The jujube date, but you don't want to have it on its own. You want to mix it with something.
Okay.
You can mix it with mint, anything.
Okay.
Yeah.
And how many jujube to put in your cup?
Just 1 or 2.
For people waking up in the middle of the night and can't fall back asleep. So you mentioned 3 a.m. is a liver qi deficiency. What if it's like other times? Is it mostly all liver qi deficiency, or depending on the time of the night you wake up, it's something different?
Well, the waking up at 3 a.m. is usually liver qi stagnation. So it's stagnant. Your emotions or stress or whatever has caused the stagnation in your liver. And the liver time is 1 to 3 a.m. The lung, it's more grief. You usually see people waking up around 4:30 or 5 because the emotion of the lung is grief. The emotion of the liver is anger. So that's usually between closer to the 3 o'clock time. But the tossing and turning, like you're waking up all night long, that's usually a blood deficiency, liver or heart blood deficiency. So blood deficiency is a little bit complicated because I tell people that they have blood deficiency, but they're like, my iron levels are totally fine. My ferritin's totally fine. I'm like, yeah, okay. Well, my favorite example to give people is that in Chinese medicine, breast milk is considered blood. So you have to think like blood isn't actually just blood. But it is nourished by things that build blood. So like again, the Da Zhao gonna help build blood, gonna help you sleep through the night, gonna help build liver blood. It's just like a really good one for insomnia. Just in general, all of the reasons that you're having it. But you can also focus on eating more dark leafy greens, making sure you're getting red meat, you're vegan or vegetarian. You can have soy products or walnuts. They help a lot to build that. Something if people are having a hard time getting it in, I'll put them on beef liver pills, which can help a lot too.
For the middle of the night waking up, you mentioned a lot of it is emotional, emotional or grief. And sometimes we're just not ready to deal with that emotion or really talk to, our partner about it or whoever. What can they do in that case? I mean, we know this, the cure is to let the emotion pass, let it flow, but sometimes it's just not that easy.
Yeah, I usually put people on herbs.
Herbs.
Yeah.
Okay.
Yeah, I usually if people aren't ready to face it, and you can't force emotions to be processed, but you can help with the side effects in your body by taking herbs because they're going to help move that liver qi stagnation, whether you like it or not. Which sometimes with a formula I'm thinking about is Shaoyasan. It's used a lot for liver qi stagnation, and it's applicable to so many different things and often used in perimenopause and menopause. It moves your liver qi. And I do notice like sometimes when people have things they're really stuck to, like they're really holding on to, they're not ready to let go of it and let it, shift or move or whatever you want to say. They'll have anxiety or it can be too moving because they're not ready yet. And in those cases, I'll lower the dose.
Is this something that we can just get on our own, or is this something that needs to be prescribed by a TCM practitioner?
Shaoyasan happens to be one of those formulas that you can usually find online and order yourself. It is a low risk herbal combination. There's nothing in there that's toxic, and there's nothing in there that's going to cause any really severe side effects. You can commonly find it, I think, even at like Whole Foods, but a lot of different stores that you go to, there's a brand called Plum Flower, and they're little black tea pills. So they're covered in food grade wax. They come from this company, Mayway.
Lower back pain. This is something I've learned to live with over the years, and it's something I hear a lot of women around me experience as well. So I've done massages, fascia release, qigong, yoga. They all help a little, but they never really fully resolved it. And I notice that it gets worse right before my period. I'm curious, how does TCM understand lower back pain?
Yeah, so in these like standard symptoms of like a pattern diagnosis, whenever anybody has low back pain that's not caused from excess or like an injury, it's usually a kidney yin or kidney yang deficiency. And so that's why it's not going away from massage or any of these types of modalities. The best thing you can do actually is to put heat on your back. You can get these moxa, the mugwort coming up, you can get these moxa patches, and you can put them over your kidneys. Or something that's really common is a kidney wrap, where you're just like wrapping an extra scarf around your kidney to make sure that it stays warm. But this can help
Okay.
nourish and relieve these like chronic back pain problems. So speaking to the note of it happening around your period, if you get to talking to different women or people who have a uterus, they will tell you their cramps are different. So some people's cramps shoot down the front of their legs and they're stabbing and they're only in the front. And that is the liver channel. And that's a liver qi stagnation cramp. But some people just have this deep ache in their low back before their periods. And that is a kidney deficiency cramp.
So would you say if someone experiences that deep low back ache, the best thing to do is to not overwork during those days
Oh,
before
yeah.
the period and just try to relax and try to do something that's nourishing and keep your lower back warm?
Yeah. And definitely make sure you're wearing socks. You're drinking the warm liquids. If you have low back pain around your period, no cold plunges. No,
Okay.
no cold plunging at all. I want to just that you don't want to be doing this cold stuff. You want to be staying warm. Don't, go like lay in a snowbank or anything. Just you want to keep your socks on, you want to keep your back warm, and you want to rest and stay cozy, have warm, nourishing meals.
Can you explain a little bit more what moxa does, the moxa stick?
Yeah. So Mox is one of the more abstract things that comes along with TCM modalities. I get asked this question a lot. Basically, a moxa stick is made up of mugwort, but it's actually mixed with a bunch of other herbs too. But mugwort's the most common herb. Aya is the opinion for it. It's a Japanese type of mugwort. And it warms the channels, which moves chi and blood. So if you have any type of pain or anything like that, the moxa is going to warm the area and move the chi and blood. It also promotes the production of blood and chi. So it's going to boost your immune function and warm the channels. For example, somebody often with infertility have kidney yang deficiency or liver qi stagnation. Or cold in the liver channel. We do a lot of moxa over the uterus and the womb space to warm the channels to promote fertility. Often with my elder patients, anybody over the age of 70, I'm moxieing the bottom of their feet quite often because it's going to help with their bone health and just their longevity and give them more energy because that's where the kidney is. So you're basically like building chi and blood with the use of the moxa, but it also moves stagnation.
So, does doing the moxa in the bottom of your feet, how different is that than doing a foot soak, like a hot foot soak?
I would say it's like a similar idea.
Okay.
Mhm.
Do you recommend people doing moxa on themselves at home, or should we see a practitioner for moxa?
I am a huge fan of people doing moxa at home. I love it. Yeah, I have a
Okay.
video about it online. You can do it to show people.
Okay.
But yeah, you can get these sticks. You can get it from your TCM practitioner. I don't know if you can order them online. I should figure that out. You can get smokeless ones, or you can get ones that are just the herb that smoke a lot. The biggest thing is you just need to make sure you don't burn yourself because it's fire
Okay.
and there's ash
Okay.
and everything. If somebody has kidney Jing or kidney indeficiency, I'm like, moxa your feet every single day. I want you to moxa your
Wow.
feet. Yeah. Um,
So you just moxa the bottom of the feet?
mhm, mhm, mhm.
Okay.
Yeah. And then for chi and blood deficiency, or like if you're having perimenopausal or menopausal weight gain, you can moxa your spleen 9, that point we talked about earlier. You can moxa your whole spleen channel. And so that's going to be on the medial aspect of your leg between your knee crease and your medial malleolus. That's basically the spleen channel there. Can max that. Also, that acupoint we talked about that builds chi and blood, stomach 36. That point is very commonly maxed as well to help with chi and blood deficiency.
When you moxa, how long do you do it for?
You at 5 to 10 minutes.
Okay.
Mm-hmm.
And you mentioned there's smokeless ones. So how does that work? Is that an electronic?
It's not electronic. It looks like charcoal. It's just burnt. They're used a lot and they get a lot of the same response. And here in the States, practicing, I think, is why they created them. Because in China, if you go in for moxibustion, they have these like vent things over the bed and it like vents out all the smoke because it can get kind of smoky. The smokeless moxa sticks are like a compact carbon with the herb in it still. It just doesn't smoke as much.
I'll definitely look into that. I've always wondered what it is, but I was too afraid to try it out because I wasn't sure how to do it myself or if I should.
Yeah, it's like I said, it's one of the more abstract things, but I want you to feel empowered. You can do it at home. It's just like basically smudging yourself with an hand or something, you know? There's a point about 4 inches below your umbilicus. It's called Ren 4, and you can max at that point. It might help with your back pain too.
How does TCM look at hormones? Or does TCM look at hormones directly? Like, do changes in estrogen, progesterone map onto a particular system or pattern in TCM?
No, they don't. But as modern practitioners, it's our challenge to translate these things into digestible terms for MDs and OBGYNs and our patient population here in the United States to understand what's going on with the language of TCM in relation to hormones. So if I were to like describe hormones to our listeners, I would say that progesterone and estrogen are both yin, but progesterone is more yin than estrogen. Testosterone and DHEA or cortisol are yang hormones in the body. So a lot of times the changes in your hormone levels in your body can directly translate into yin and yang changes in your body. And so you can look at it like that. But there's plenty of practitioners who are doing an integrated approach who have been taking classes or CEUs to learn the language of biomedicine. But a traditionally trained practitioner who's practicing just traditional medicine, they're not going to be using those terms.
Can you also share a bit more about herbs that women can explore for perimenopause support?
Yeah, like my standard yin deficiency patient who's presenting in a very standard yin deficiency way, I will put them on a form of Liu Wei Di Huang Wang. It's also a formula you can usually get online. You don't always need to have a practitioner. That same company, Plum Flower, provides a lot of these formulas to the general public. That formula is often modified for the kidneys. This is like a general kidney tonic. If you have kidney deficiency and you have a lot of eye symptoms, blurring of vision, headaches behind the eye, you wake up and your eyes hurt, you're going to take what's called Qiju Di Huang Wang. And in that formula, we basically add goji berries and chrysanthemum because those are good for eye health and the liver. If you're having more liver symptoms like irritability, red flushing of the face, severe mood swings, alternating digestive issues like constipation and diarrhea, that's when you're going to want to go to a Xiaoyasan or a Jiawei Xiaoyasan. And those also you can get over the counter. There's also 2 different tea combinations. We talked about Da Zhao. You can combine that with ginger, but I recommend drinking that in the morning time. And then there's another combination that's really commonly used for a lot of perimenopausal and menopausal symptoms, which is just the chrysanthemum plus goji berry. One of my teachers described it as the effects of drinking a glass of wine. Like he was talking about how his perimenopausal and menopausal patients want to drink wine because it takes the edge off, but their body can't handle the wine because it's exacerbating their symptoms. It's causing insomnia or like all of these things. And he's like, for patients like that, you want to have them drink the juhua and the gochitsa, which is chrysanthemum and goji berry tea.
How much chrysanthemum and goji berry to use?
It's just like 4 or 5 chrysanthemum flowers and like 4 or 5 goji berries. Not very much.
That's it.
Yeah. And The last herb I want to shout out to in relation to the perimenopause, menopausal brain fog is lion's mane, which isn't a Chinese
Mm,
medical herb, but I just love it so much for cognitive function.
okay.
That's a really good one. And back on the topic of sex, you maybe are having like a severe decline in libido, you're having a lot of dryness. I really like this herb Mirapuama. It's from the Amazon, very strong aphrodisiac, and it promotes fluid production. And then Damiana, which is from Mexico.
What kinds of lifestyle changes tend to be the most supportive during this phase?
Big ones are drinking warm water, wearing socks. I keep saying that.
Yeah.
The kidney channel on your foot starts at the bottom and then it comes up and then it actually does like a little loop near your malleolus. And there's like 6 points out of the 27 that are on its channel just on your feet. And then it goes up and like kidney 7 and 8 are also like on the ankle. We like you to wear a sock, like an ankle sock. I want you to cover your ankles, not just like a footy. 3 to 5 servings of cooked vegetables a day. The vegetables in the brassica family, Brussels sprouts, cabbage, broccoli, they all help your body to eliminate extra hormones and xenoestrogens, which basically just helps your body detox from environmental toxins. And it's going to help build qi and blood as well to have cooked vegetables. So a serving, I'm talking about like a fist amount, like this is your serving size. Light exercise, so tai chi, qigong, restorative yoga, walking, all of those things. Mugwort foot soaks or a foot soak at nighttime. No overworking, especially in this time of perimenopause and menopause. It's like, please don't overwork. Like, you've been working a lot for many, many moons. Just take a little break. Try to do whatever you can. Avoid greasy fried foods. They're very stagnating. Avoid cold foods, avoid alcohol. And there's some foods that, like we were talking about, how fat is a very yin food and it goes directly to your bones. There's like a lot of yin foods that you can eat that are going to help boost your yin. So the color of the kidney is black. And so all black foods nourish the kidney. The most common one is black sesame seed that people can find easily. And you can get black sesame tahini. So, like any recipe that you put tahini in, I recommend trying to make it with black sesame just to help have like a little bit more of a nourishing effect on the kidneys. But all the yin foods that are high in fat, so like seeds, also beans are not high in fat, but they're very nourishing for the kidneys because they help with fluid passages. High quality protein from meat is great, really important. Cooking with a lot of water, all of these things. So diet's huge. Diet is something I talk about all the time, especially if people are having severe perimenopause, menopausal symptoms. I'm like, what are we eating? Are you eating in the morning? Like, I would really like you to have a high protein breakfast within the first 2 hours of waking up. And I really want to reiterate getting a lot of rest, especially in the winter. Yeah, I'm going to just keep telling you to sleep
Yeah.
more, rest more, put
Yeah.
your feet up, all these things. Yeah.
I think my biggest takeaway is don't overwork, rest, like you said,
Yeah.
and keep your feet warm, keep your lower back warm,
Yeah.
and drink and eat warm foods, and be careful on the cold consumption and the cold plunges or anything cold. What's one thing you wish all women understood about this season of life?
I just wish that more people would realize that it's not a death sentence. It's really just invitation for more freedom in your life. And you still have so many more years to live. Just average life expectancy is at least 30 more years. You still have that entire amount of time that you were bleeding and in this reproductive era of your life to live a whole nother 30 years. I wish people would embrace it more and stop focusing so much on like the negative aspects of perimenopause and like in menopause and like it's this lack and that you need to be doing all of these things. And really just sink into the becoming of a wise woman in this life and like the rest and the enjoyment and the expression of your spirit and your true essence. And you're not losing anything. You're just transforming it into different energy.
So really viewing this season as a transformation into really the second spring, the second half of your life, literally a
Basically.
second half.
Yeah. It's really exciting. I wish more people were excited about it. So that's what I'm always trying to help people feel.
If we can see what the other side of what we're becoming, instead of just focusing on what we're losing, it's having something, a vision or something to call us forward, to look on the other side as opposed to keep looking behind what's not here anymore. And I think that, and that's why I want to do this podcast, is to bring more awareness of like, well, what is happening? What are the different ways of viewing this phase of life? There's a reason why we live way past our fertility. What is the meaning, of living past our fertility? What's the meaning of that season, of that half of your life? And I think we don't have enough role models, to show us how powerful or how great it can be, because the narrative is on, how sad it is to be old.
Yeah, I've been thinking about this a lot, and I really want to have this. I wish we had these parties. Like, the only thing that I can ever think about calling it is the croning. And I wouldn't say that it's directly like a woman in menopause. I would say it's more like the next cycle of 7, like the 8th cycle of 7. And like have this like honoring of like, this gift of in celebration of life, and like honoring these elders, and like the sharing of wisdom, and having more women talk about it. And I also think like with, your red tent, the red tent ceremonies where you're talking about, women are stepping into womanhood and they're having menarche and your bleed. Like, I really wish that as a society, we would have more events like this. And then you would have these, postmenopausal women or grandmother figures like showing up at this red tent or menarche ceremony to like share the wisdom. And you're having like the child, the mother, and the grandmother all there together to really like embrace and communicate and talk about the many wonders of living in a female body and all of the changes that we go through.
Yeah, speaking of celebrating, I went to Autumn Woman Harvest Queen. It's with Jane Hardwick. And we did a ritual, a celebration for the 3 women who were, officially in menopause. And so the rest of us were not. We were the witness. It was a really nice celebration where they made these like flower crowns. They stood in the middle, and then we went around, each one of us, telling them how, appreciating their wisdom, thanking them for what they bring. And then we each ask them, what are you harvesting in this season?
Beautiful.
And what do you want to give back? I thought, wow, like that is something we should do more of, recognizing this is like a big birthday, right? It's a big birthday.
It really is. And it reminded me of something I wanted to mention earlier, is that in the cycles of 7, this cycle that we go through is a winter cycle. Post-menopause, the next one, and so the autumn, and I like the shift from autumn to winter. If you want to look at it like that, you're reaping your harvest and all of these things, going through this transition, and then the next years after it, for a little while, are winter, where you're planting a seed, the seeds for what you're going to bring to the community in the future. Thanks for sharing about that. It sounds beautiful. I love that.
Well, thank you, Dr. Tara. This was very enlightening for me, and I personally learned a lot, and I really appreciate all your tips, whether it's the acupressure points, the herbs, and really just reminding women that this is a season not to keep pushing through, but to really give yourself the permission to take a break and slow down, how important that is. For our listeners who want to maybe work with you or learn more from you, where can they find you?
I have my website, tiliaintegrativehealth.com. On there, you can learn more about me and you can book online. I do telehealth as well as in-person appointments. I'm on Instagram at Tilia Integrative Health. I also have an herbal company called Gold Dragon Alchemy, where I do other informative videos and stuff, where you can find me on Instagram as well at Gold Dragon Alchemy. And I have a YouTube channel called Dr. Tara's Take, and I talk about all sorts of different stuff on there as well.
If you're listening and this conversation expanded how you think about perimenopause beyond hormones, beyond symptom management, this is exactly the kind of lens we explore on this podcast. Not as a problem to fix, but as a shift in how the system operates and how strategy needs to change with it. You'll find the links to Dr. Tara's work in the show notes. And if this episode was useful, subscribe to the podcast and share it with someone who's asking similar questions but hasn't found language for them yet. As always, thank you for listening. I'll see you in the next episode.